Hi, my name is Riley French, and this is my presentation for adolescence and the transition to maturity. So I'm going to be talking about comprehensive sexual education in schools and what that would look like. So first, we're going to begin with why comprehensive sexual education in public schools is so necessary. So number one, the U.S. has high rates of teen pregnancy compared to other developed countries. When people are uneducated about STDs and STIs, as well as teen pregnancy, we see higher rates of cases of each. Number two, with the recent overturning of Roe v. Wade, the prevention of unwanted pregnancy has become dire, and education about and access to contraception is essential. Options are depleting for pregnant people around the US, and teens are the most vulnerable to the effects of this decision. Three, finally, sex is a large part of a lot of people's lives. So this graph shows that 44% of females and 47% of males aged 15 to 19 reported having sexual intercourse. The sheer amount of people who have sex and the adults in America who have never been formally educated about this topic is baffling. The average person has sex 45 times a year. Being such a large part of the average person's life, it only makes sense that it would be discussed in a controlled environment at least once in their lives. Um, so the CDC is quoted in saying, promoting and implementing well-designed sexual education positively impacts students' health in a variety of ways. Despite the CDC stating many times the benefits of comprehensive sexual education in schools, there are no federal laws detailing what should be taught. This leaves the subject completely up to states. So we see in this graph the 14 states with the highest rates of teen pregnancy among girls 15 to 19 years old. When put next to this graph depicting the details of sexual education taught in public schools around the nation, we can see a trend of higher rates of teen pregnancy in states with limited to no sexual education. So what does comprehensive sex ed look like? Um, so I've broken down my presentation into four parts and how I would posit that we introduce sexual education into the US, starting with professionals, then moving to timing, then content and conclusions. So we're going to start with professionals, reliable people, and information. So the two main benefits of introducing professionals into the classroom are relaying accurate information and meet them at their level. So first, accurate information. This is a quote from Planned Parenthood. Of the states that require sex or HIV education, just 39, fewer than half require it to be medically accurate. This means that there is no regulation when it comes to education surrounding sex in these states. That could lead to biased and irresponsible reporting to students. This misinformation could range from shaming or guilt tripping to purposefully misleading and having lifelong effects on students' lives. When adolescents are unable to receive information from trusted adults in their lives, they may turn to other reliable sources, for example, other students. Misinformation about important topics like STDs and teen pregnancy can be detrimental to a student's life. It's important for teens to be educated on these topics as they transition into adulthood and start making decisions that have the potential to change their lives. Where's the next place that people turn to for information? The internet. As many of us know, the internet can have lots of very reliable and useful information mixed in with a lot of dark and non-unseeable images. When it comes to education on sex and bodies, researching it online can be dangerous, and there's no guarantee that the information gathered is accurate. So that brings us to our second reason why bringing professionals into the classroom would be a huge benefit, their ability to meet students where they are. As I said before, turning to peers on the internet may lead adolescents to seeing and reading things they may not be ready for. That could, at best, just be a little scary, and at worst, alter how they view sex for years to come. Bringing in a professional who is not only knowledgeable about sex, but also knows the ins and outs of adolescent development is an essential part of the plan to introduce comprehensive sex ed into schools. In order to be someone in adolescents' lives that can give them age-appropriate information, they must understand what is age-appropriate. As stated before, many adolescents may turn to their peers when they have questions about sex. Many have posited that peer groups are related to increased delinquency, use of drugs and alcohol, and teen pregnancy. Introducing a professional that understands things like peer groups can help meet teens where they are. And then finally, the approach. So an empathetic and an unbiased approach is crucial to encouraging a judgment-free environment. That's only purpose is to answer questions and relay important information. This will teach students to respect others' choices and opinions. Which takes us to our next step in comprehensive sex ed in schools, which is timing. Not only when, but how much. So when looking into effective timing of sex ed, Sweden quickly came onto my radar. Their lessons not only focus on when to give students information, but more importantly, how much time should be spent on giving them this information. The idea demonstrated in Swedish sex ed is to start young so that the topics of sex are less of a taboo subject once they get to adolescence. Comprehensive sex ed stresses the importance of communication. Communication comes more naturally when it's encouraged over many years. That's an in-depth sexual education only makes sense once students have developed the ability to conceptualize the idea of possibilities. Decisions around sex can have consequences that follow people, which is why early adolescence is the most important time to emphasize the outcomes of making certain decisions about sex. It's important that education stays age appropriate. For example, in Sweden, young children learn about bodily anatomy. Then they learn about sexual desires and safe sex, and older adolescents learn about STDs and STIs. Which brings us to our final section, which is the actual content of sexual education. So I was able to condense the many topics I wanted to include in my proposal for comprehensive sex ed into 4 categories with many subsections. The cohesive blend of emotional education and bodily facts and statistics is the key to any sexual education curriculum. So, for example, I have puberty and development, masturbation, human reproduction, as well as respect for others and emotional maturity, peer refusal skills, etc., etc. So adolescence is a crucial time to learn this lesson, as it is the time when people develop attitudes about a lot of things. Not only do students learn accurate information about their own body and others, but they learn to respect others' opinions and choices in the years of education. Teaching adolescents to be respectful and to expect respect in return is what my proposed plan of comprehensive sex is built on. Which leads us to the conclusion. In my research for this project, I found that America is at an all-time low in terms of teen pregnancy rates. This is due in part to the many advocates of comprehensive sex ed in school. The ever-increasing appearance of sex ed in America has resulted in a steady decrease in teen pregnancy. This decline is evidence that implementation of sex ed in schools is working in terms of encouraging teens to make informed decisions about sex. Okay, that was my presentation. Thank you so much for listening.